In this video, I'm presenting to you a case of a 55-year-old patient with sudden loss of vision in their right eye. There's no RAPD, and here's the case. So we can see there looks like there's some cells in the anterior chamber. But are they cells? They look a bit darker than cells from inflammation normally would, and maybe a bit pigmented. So are they from the iris? Is there some blood? Where is it coming from? Let's carry on with the exam. So, looking in the anterior vitreous, you can see that there's actually some red, orangish pigment in the anterior vitreous. And with the history of sudden loss of vision, you have to think, is this a vitreous hemorrhage? So let's have a look. We can tell that the patient's pseudophakic because we can see the outline of the anterior capsule from where the capsular excis had been performed. And let's try and have a look at the retina. So really trying to focus here and asking the patient to look in different directions just to see if we can see anything at all, any focused detail of the retina, even in the retinal periphery. But there's not a great deal to see here. Now, if you can't see any of the retina at all, an important thing that you have to do is to do a B scan, an ultrasound scan, to see if you can see whether the retina is flat or not. And you have to ask the question, well, is this a vitreous hemorrhage which is related to a retinal tear or a hemorrhagic PVD? In which case, you really have to be careful to take prompt action to determine whether or not you need to do a vitrectomy or a vitreoretinal procedure to identify the cause of the break and treat the retinal tear or retinal detachment which may exist, or is it related to something else? Well, how do you tell if it's from a retinal tear or diabetic retinopathy? And the answer really is check the other eye, because that will give you lots of clues. Now, in this patient is a 55-year-old patient with very poorly controlled type 1 diabetes. They've got a history of multiple previous episodes of panretinal photocoagulation and also having had a vitrectomy. So in this case, we were fairly sure that the cause was a vitreous hemorrhage from proliferative diabetic retinopathy and referred the patient to our VR colleagues.